Hi, my name is Trevor Schmidt. I am the liposuction specialist here at MyShape Lipo. In this video I'd like to explain a little bit more about how we perform the procedure liposuction here at MyShape Lipo. First of all, the definition of liposuction. Liposuction is the physical removal of fat cells. So you have to think about your body and you're going to gain weight in your body where you have fat cells. So people have these problem areas. Their problem areas may be their stomach, they may be their outer thighs, their arms, their chin. These are areas where you have an abundance of fat cells. So with liposuction, we're physically removing them from your body and they won't be a problem again. All the studies say that fat does not reproduce in your body. How we do this is very simple. We're going to make these tiny little puncture holes, and you see this instrument here. This is called a biopsy punch. And the little tip here is essentially it's a metallic blade that's circular in nature. It's 2 millimeters in diameter. It's very, very small. It's about the size of a small mole that you might have. And essentially we're going to make these circular holes, and those are our access points to pass our instruments. Now the first part of the procedure is getting you numb. We're going to be injecting the fluid, the numbing fluid, into the area that we're treating through these access points. The instrument that we use is called a cannula. It's a small instrument. You may have difficulty seeing it, it's so small. It is long. The advantage of having a longer instrument is that I don't have to make as many holes, because through one hole I can reach all the way across your abdomen. And so that eliminates a number of holes. I know other doctors make multiple holes on the abdomen, and we make very few, which gets you better results and less scars. So the numbing fluid that we're going to inject into the area, it consists of saline, which is simply salt water, lidocaine is a numbing medication, and epinephrine is a medication that constricts the blood vessels. And constricting the blood vessels is basically pushing all the blood away from the area, so we have less bleeding during the procedure as well as less bleeding after the procedure. And the nice thing about having less bleeding after the procedure means that you have less bruising. And as you know, with less bruising, you're going to have less discomfort and an easier recovery after the procedure. Once we get the area numbed up, we can go with a slightly larger instrument called a cannula. This is the instrument that we remove the fat with. There's a couple of holes at the tip here, and then it attaches the suction at this end here. We go in there underneath the skin and physically break up the fat and suck it out into a canister. Now once all the fat's gone, if you can imagine, you have the skin on top and muscle on the bottom, and all the fat in the middle. So we're going to remove all the fat from the middle. Now you have a big space. Well, that space isn't going to remain. Now the body's natural reaction is going to want to fill that space with fluid or swell up. So we don't want that to happen, so we recommend wearing a compression garment. The compression garment effectively closes down that space and reduces the amount of space that you can swell into. And having less swelling leads to a quicker, easier recovery. We ask that you wear the compression garment for at least 2 weeks after the procedure. Now if you do research online, you'll find that there's doctors that recommend wearing the compression garments for 2 to 6 months after the procedure, which I believe is a little overkill. On the other hand, there are some people that would benefit from wearing it longer. And it's not bad to wear it longer. We just recommend at minimum you wear it for 2 weeks for the best results. Some people are going to find they like it and they'll wear it longer, and other people hate it and want to get rid of it as quickly as possible.